So one of the disadvantages of being a skin doctor is getting a phone full of unsolicited mole pictures from your friends and family every day. I'm Dr. Michael Massie, and here to talk to you about moles and what you can look for on them to see if they're of concern enough. So I've partnered with Bakscape today to talk to you about moles, including moles on your back, ones that you might not have even known you had until you shaved it. People use mole in like layman's terms to just consider bumps. What I'm referring to when I'm thinking about a mole is something called a nevus. So they're pigmented changes in the skin that have come to these areas, and depending on which layer of the skin they're in, they have different names for the type of nevus that they are. And then some of them, depending on if they look typical or atypical, have chances to turn into something cancerous like melanoma or other types of skin cancers. Checking moles is an important part of what I do every day in the clinic. We look for signs of pre-cancer or cancerous changes, and it can actually save people's lives. There's things you can do at home though to actually check the moles yourself to see if they're things that should be brought into me. There's actually a trick for this. It's remembered by saying you do the ABCDEs of the mole. So A is for asymmetry. If the mole isn't symmetrical, it's likely higher risk. B is if the border is irregular. If it's jagged instead of smooth, that's something that we want to see as well. C is for colors. If there's more than one color in the mole, that's a sign that's also a little bit concerning. D is the diameter. It depends on who you ask. Usually I say over 0.5 centimeter is something worth to see. And then E is if it's evolving. So if it's changing over time. So any two of those, even one, it's worth having a practitioner come and check out your mole. If you cut a mole off while shaving, it's not to worry about. Often they will just return after a scab. There's nothing dangerous to having that happen. So regular self-examination is important with following up with moles. After you shave your back with Bakscape, take a look yourself, have someone look for you, and if you see any of the ABCDEs and are concerned, come see a skin doctor like myself to check it out. And please, no more mole pics in my DMs.